If someone in your family is facing dementia or cognitive decline, you already know how devastating it can be. Watching a loved one lose their memory, their personality, and even the ability to recognize the people closest to them is one of the most emotionally exhausting experiences anyone can go through. In the United States, where Alzheimer's disease alone affects over 6 million people, families are left desperate for answers, for hope, for anything that can slow this cruel disease. People in the United Kingdom, Canada, and Australia are also seeing these heartbreaking changes in their aging populations, but the US remains at the top when it comes to both the number of cases and the cost of care. With prescription treatments offering limited results, the pressure grows on families and caregivers to explore alternatives, and that includes powerful, science-backed supplements designed to support brain health, memory function, and overall cognitive resilience. The most well-researched and widely used supplement in dementia care in the United States is omega-3 fatty acids, specifically DHA and EPA found in fish oil. This isn't just hype, it's evidence-based. DHA, or docosahexaenoic acid, is a structural fat that makes up nearly 30% of the brain's gray matter. When levels of DHA drop, the synapses, the places where neurons communicate, begin to break down. In many patients with dementia, especially Alzheimer's, these synaptic pathways are heavily damaged. Studies from institutions like the National Institutes of Health and the Alzheimer's Association have shown that omega-3s may slow cognitive decline, improve mood stability, and support better communication between brain cells. Families across the United States have reported noticeable improvements in focus and memory after consistently using high-quality fish oil. But this isn't just about popping a pill. Dosage matters. For cognitive support, doses of at least 1,000 milliliters of combined DHA and EPA per day are typically recommended, though some experts push for even higher levels. Another critical supplement that's gaining attention across clinics in Canada and the United Kingdom is phosphatidylserine, a phospholipid naturally found in brain cell membranes. As people age, natural levels of phosphatidylserine drop, and this reduction is directly linked to memory lapses, confusion, and slower cognitive processing. Supplementation with phosphatidylserine has been shown in several clinical trials to improve memory recall, attention span, and even language processing in seniors with mild cognitive impairment. In fact, in the United States, it's one of the few supplements that the FDA allowed to carry a qualified health claim related to dementia support. Caregivers have described cases where seniors who had previously struggled with basic conversations showed clearer thinking and reduced confusion after several weeks on this supplement. It's also well tolerated and doesn't interact with most medications, making it a safer option for older adults who are often on multiple prescriptions. Acetyl L-carnitine is another powerful tool that has been showing up more frequently in dementia care protocols in Australia and the United States. This amino acid derivative crosses the blood-brain barrier and helps produce cellular energy inside the mitochondria. In brains suffering from dementia, mitochondrial function is severely impaired, leading to neuronal fatigue, oxidative stress, and eventually cell death. By fueling the mitochondria, acetyl L-carnitine provides the brain with a kind of metabolic jumpstart. Studies published in journals like Neurobiology of Aging have shown that it may enhance attention span, verbal memory, and mood in elderly patients. In the United States, many neurologists have included it in multi-supplement protocols for patients in the early stages of dementia, especially those who still maintain some independence but are starting to experience cognitive dips. There are also anecdotal cases where patients have regained some sense of daily routine and recall abilities after a few months of supplementation, particularly when used in combination with other mitochondrial support nutrients like CoQ10 speaking. Of CoQ10, ubiquinol, the active bioavailable form of coenzyme Q10, is another supplement that is increasingly used in dementia management strategies in both Canada and the United States. This antioxidant is not only vital for energy production in the brain, but also plays a key role in reducing oxidative stress, a major driver of neurodegeneration. The aging brain becomes more vulnerable to free radicals, and without strong antioxidant defense systems, these free radicals cause inflammation, cell death, and the slow breakdown of memory and cognition. Seniors, especially those over 70, often have very low levels of CoQ10, particularly if they are on statins or blood pressure medications, which are common in American seniors. Supplementing with 100 milliliters to 300 milliliters of ubiquinol daily has been reported to improve mental clarity, lessen mental fatigue, and even improve emotional stability in patients suffering from both Alzheimer's and Parkinson's. Families have said they noticed a difference in energy levels and communication ability in their loved ones after just a few weeks. Next, we come to curcumin, the bioactive compound in turmeric that's been at the center of neuroprotective research for over a decade. Curcumin's anti-inflammatory properties have shown promising results in reducing the plaque buildup associated with Alzheimer's disease. In many dementia patients, these plaques, called amyloid beta plaques, choke off communication between brain cells and led to their eventual death. Clinical trials in the United States and Australia have tested highly bioavailable forms of curcumin, such as Meriva or Theracurmin, which have up to 29 times greater absorption than standard turmeric powder. Results show improvements in attention, mood, and working memory. The emotional testimonies from caregivers are powerful. Some have said their family members became more responsive and less agitated within 2 months of starting curcumin. It's important to note that curcumin also supports gut health and liver detoxification, which can further benefit brain health due to the gut-brain connection that is being studied extensively in both the US and United Kingdom. When the gut is inflamed or leaking toxins, the brain often suffers. A condition known as neuroinflammation. Vitamin D is another crucial piece of the puzzle, especially in colder regions like the United Kingdom and Canada, where sunlight exposure is limited. For much of the year, deficiency in vitamin D has been directly associated with increased risk of Alzheimer's and other forms of dementia. In the United States, research from places like the University of California and Boston University have linked low vitamin D levels with brain shrinkage and faster cognitive decline. Seniors who are indoors most of the time or living in care homes are especially at risk. Supplementing with vitamin D3, preferably alongside vitamin K2 to ensure proper calcium metabolism, has shown to support better memory, reduce depression, and even increase alertness. Blood testing is important here. Many doctors now recommend seniors maintain a serum 25-hydroxy OH level of at least 50 ng/ml for optimal brain function. In many cases, caregivers reported subtle but important changes, such as seniors being able to recall recent events or manage personal hygiene better once their vitamin D levels were corrected. Another supplement that has shown tremendous promise in supporting cognitive function and slowing the progression of dementia, especially in elderly patients in the United States, is lion's mane mushroom, Hericium erinaceus. This isn't just a trendy herb from the health food aisle. Lion's mane contains 2 compounds, hericinones and erinacines, that stimulate the production of nerve growth factor, NGF, a protein crucial for the survival and regeneration of neurons in the brain. NGF levels decline significantly in individuals with Alzheimer's disease and other neurodegenerative conditions. In several small-scale clinical trials conducted in Japan and later reviewed by neurologists in Canada and the United States, Lion's main extract led to statistically significant improvements in cognitive scores for individuals with mild cognitive impairment after just 12 weeks. Caregivers in senior care homes in California and Florida have noted that patients who were previously disengaged or had trouble forming sentences became more alert, started recognizing faces again, and even engaged in meaningful conversations when Lion's Mane was added to their regimen. The standard dosing used in these studies is around 1,000 milliliters to 3,000 milliliters of extract daily, but it's critical to use an extract with a guaranteed percentage of active compounds. Most over-the-counter products in the United States don't meet that standard unless you choose carefully. Magnesium, especially in its glycinate or L-threonate form, is another supplement that deserves attention, not only for its role in mood and sleep regulation, but also for its direct effects on synaptic plasticity and memory formation. Magnesium L-threonate, in particular, has a unique ability to cross the blood-brain barrier and increase magnesium levels in the cerebrospinal fluid, something most magnesium forms can't achieve. In studies supported by MIT and published in the Journal of Neuroscience, older adults taking magnesium L-threonate showed improved executive function, better working memory, and increased brain density. These are outcomes that are incredibly rare in the world of dementia care. Families in the United States have described noticeable shifts. Grandparents who had trouble following a conversation began participating again. Seniors who suffered from sundowning syndrome experienced fewer late-day confusion episodes. In Australia and the United Kingdom, neurologists are slowly starting to include magnesium L-threonate in dementia care protocols, especially for patients who also suffer from anxiety or sleep disruptions, two common symptoms of cognitive decline. A daily dose of around 100 mg of elemental magnesium from about 2,000 milligrams of magnesium L-threonate is typical in these studies. Another major player in brain support is B-complex vitamins, especially B6, B9, folate, and B12. These vitamins play a critical role in reducing homocysteine, an amino acid that, when elevated, is linked to brain atrophy and a higher risk of dementia. In many elderly patients in the United States, high homocysteine is overlooked, even though it can be corrected quickly with the right supplement. A landmark study known as the VitaCog trial in the United Kingdom found that high doses of B-complex vitamins slowed brain shrinkage by as much as 30% in older adults with mild cognitive impairment. It's a shocking result when you consider how inexpensive and widely available these vitamins are. Yet many seniors in the United States and Canada still suffer from deficiencies, especially those on medications like metformin or proton pump inhibitors, which deplete B12 levels. Doctors specializing in geriatrics have reported patients who were practically nonverbal began forming sentences again after being treated for B12 deficiency. Others who were severely confused due to low folate regained enough mental clarity to manage personal tasks independently again. It's crucial to use methylated forms, methylfolate, and methylcobalamin because many older adults have MTHFR gene mutations that reduce their ability to process synthetic folic acid, or standard B12. One of the most overlooked yet deeply effective supplements for brain health is resveratrol, a compound found in the skin of red grapes and in Japanese knotweed. It works by activating a family of proteins called sirtuins, which help protect against age-related cognitive decline, inflammation, and mitochondrial dysfunction. In Alzheimer's patients, brain inflammation is often rampant, and sirtuins help calm this storm. A study conducted at Georgetown University Medical Center and supported by the U.S. National Institute on Aging found that high-dose resveratrol could preserve the integrity of the blood-brain barrier and reduce biomarkers associated with Alzheimer's progression. Patients taking resveratrol maintained better scores on cognitive tests over 12 months compared to placebo groups. In real-world settings in the United States, caregivers of patients who started taking resveratrol, usually in doses of 250 milliliters to 1,000 milliliters daily, reported that their loved ones had fewer episodes of agitation, were more emotionally regulated, and even regained small but meaningful functions like remembering names of children or preparing small meals. Resveratrol's ability to mimic calorie restriction also supports better metabolic health, which is tightly linked to brain aging. People in the United States dealing with both type 2 diabetes and cognitive decline may especially benefit from this dual effect. For seniors suffering from anxiety, restlessness, and sleep disorders, common symptoms in mid to late stage dementia, L-theanine can be transformative. Found naturally in green tea, L-theanine promotes a calm, relaxed brain state without sedation. It works by increasing alpha brainwaves, the same ones seen during meditation or relaxed wakefulness. In clinical trials conducted in both the United States and Japan, L-theanine helped reduce anxiety, improved sleep quality, and in some cases enhanced focus and attention. Family members of seniors with dementia often report that their loved ones struggle with what's known as sundowning, where confusion, irritability, and agitation spike in the late afternoon or evening. L-theanine, especially when combined with magnesium or melatonin, has shown to dramatically reduce these symptoms, improve overall sleep quality, and make the daily caregiving experience less traumatic for everyone involved. Most effective doses range from 100 milliliters to 400 milliliters per day. And unlike benzodiazepines or sedatives, L-theanine doesn't cause drowsiness or impair cognition, making it safe even for seniors in fragile states of health. For those who are seeking a more comprehensive solution, combining these supplements into a structured, rotating protocol has been practiced in advanced integrative clinics across the United States. Instead of trying everything at once, doctors use cycles, 3 months, on a cognitive support stack, followed by reevaluation. Supplements like phosphatidylserine, DHA, magnesium L-threonate, and lion's mane are often used as the foundation, while others like L-theanine or acetyl L-carnitine are brought in to target specific symptoms such as sleep disruption or low motivation. Family members are often coached on how to track behavior, memory function, and emotional stability using basic scoring tools like the MMSE, Mini Mental State Exam, or caregiver logs. These protocols aren't about reversing dementia. That's still beyond our reach, but they are about preserving dignity, delaying decline, and improving quality of life. Many U.S. caregivers speak with tears in their eyes when describing a moment where their loved one recognized them again, or finally remembered their spouse's name after weeks of silence. These aren't miracles. These are results rooted in nutrition, neurobiology, and the belief that the brain, when supported correctly, can still fight back.